Good afternoon, this is Dr. Christine Ebert-Santos at Ebert Family Clinic with our weekly update on COVID in the mountains. We have some questions today that we're going to start out with from the Communities That Care organization sponsored by our county government, and then I'll give you the latest from our weekly meeting with Children's Hospital experts. Children and social distancing can be a challenge. I called up my friend Brianna, who's a nurse with 5 children, and talked to her about it last night. She pointed out that kids are always sharing and touching each other, but her advice is if the kids are going to play together, to have them play outside and have them each have their own toys and not share toys. And especially if they're balls, maybe they're going to play basketball, they should each have their own basketball or wear gloves. Try and keep within your own bubble of social contacts, the small number of people that you've been around for the last 2 months, and don't expand that too rapidly. Know your network is a slogan from the AIDS campaign that applies here. You know who's been sick and who's been well and who's been behaving cautiously, and we should continue those behaviors. The decrease in social distancing is going to be very gradual over the next few months. There's also going to be what the panelists at Children's Hospital called an accordion effect, where we loosen up a little bit, then we'll see some increase in cases, and then we'll tighten up a little bit. So things are not going to change overnight. Anyone who has an underlying lung problem like asthma or cystic fibrosis will be increased risk of complications from COVID, but not necessarily increased risk of catching COVID. Children in general have not been very sick, and very few of them have had a severe illness with this virus. I have talked to several parents who are concerned about their children that have Down syndrome or who are on immunosuppressants. They have prolonged the social distancing, and they have been using masks more whenever they leave the house. Other than that, it's the hand washing and keeping your hands away from your face. You can call your medical provider for symptoms if you need an appointment. We do appointments by telehealth, and if it's more severe and your oxygen is low, you may need to go to the emergency room. We are not doing any testing here because it requires the personal protective equipment, which has been in short supply up to now. But as you can read in the paper, and you can go to the summitdaily.com COVID site, there are many places doing testing now, including Vale Health testing at the Howard Head facility in Silverthorne on Tuesdays and Thursdays, and the Occupational Health Office for Centura here in Frisco has testing hours every day, including Saturday and Sunday. The number to call was in the newspaper. Pediatricians across the country are very alarmed with a dramatic drop in vaccination rate. This could lead to further outbreaks of measles, pertussis, pneumococcal pneumonia, and other serious diseases in the next few months. It's very important that children get their checkups and get their vaccines. It's also very important that teenagers, middle school age children and teenagers get their checkups, because depression and anxiety are very dangerous at this age. And whenever we do a checkup in these age groups, we do a screening for depression. One mother told me that saved her daughter's life. Call the office, make an appointment. If you don't feel comfortable leaving the house and coming in for a hands-on appointment, we can do a 2-step appointment with a preliminary telehealth appointment followed a month later by a hands-on appointment where we can do the part of the exam that is hard to do by telehealth, such as listening to heart and lungs and looking in ears. The expert panelists at the Children's Hospital meeting that I attended last night on Zoom said that our offices and clinics are the safest place to be in this outbreak. We are all taking extra precautions not to bring anybody with possible contagious diseases into our offices. There was an article on April 20th published in the New York Times proposing that pulse oximetry be used to screen for COVID. Since the tests that have been done up to now take several days to get the results, and the important outcome of testing for COVID is to know who is at risk for severe complications, it seems that knowing that somebody's oxygen is low is the most important piece of information that we need when we are trying to decide how to treat somebody that has symptoms that could be consistent with COVID. This physician who has worked in the terrible epidemic that they face in New York has advocated that measuring people's oxygen with a simple pulse oximeter will screen out the people who are doing all right and can just stay home and the people who need medical attention. This is something that I've been saying ever since we first started talking about this. We also talked about daycares in our meeting last night. Many daycares have been open because healthcare workers have to have their children taken care of, but other daycares will be opening soon, and parents are asking me whether they should send their child back to daycare so they can go to work. Most daycares will probably not be at full capacity because there will be enough parents who elect to keep their children home, so the number and the amount of exposure should be low. Children are not at very high risk for contracting or spreading COVID, so we're not as concerned about them getting sick. If any child who is attending daycare does have symptoms, they should immediately be sent for testing. Daycares have had to meet high standards put up by public health to provide these services in a safe manner. If you have a high-risk family member, I would advise that you not send your child back to daycare. If you would like to ask some questions or you would like more information, you can email mandy.kennedy@summitcountyco.gov.